Hi friends, welcome to classes by Lab Doctor. In today's class, let us briefly understand how do we exactly do this angiography. So I have told you angio is blood vessel, graphy is the study of this blood vessel with the help of an X-ray. So in this angiography, we are studying the blood vessels. It could be blood vessels of your heart, blood vessels of your kidney, blood vessels of your lungs, blood vessels of your liver. It could be anything. The study of blood vessels is called as angiogram. But we focus here on the blood vessels of the heart, the coronary arteries. So this process is called as catheter angiogram, the most commonly done angiogram, the catheter angiogram. So here when we do this angiogram, we try to find out if there is any blockage, if there is any occlusion, if there is any kind of a defect, congenital defect, abnormalities, some other connections of the blood vessels, etc. through this angiogram. But we require certain preparations for this angiography. So, how do we prepare a patient for angiography? Before this, I have made a video on what is angiogram, what is actually the indication of an angiogram, what are the different types of angiograms, what are the different methods to find out the heart blockages, etc. You can also go through that video. So, how do we prepare a patient for angiogram? So remember, angiography is done in a hospital or a radiology department or in a hospital room only, and this angiogram, the procedure can take anything from half an hour to 2 hours, and usually this is an OPD procedure. You can go, you can be discharged the same day if there are no major complication, which usually doesn't happen. But remember, this is an OPD procedure. You can be discharged the same day. Before you the doctor takes you for this procedure, they'll ask you about allergies, they'll ask you about allergy to any medicine or seafood or any dyes, etc. You will be asked if you are taking any kind of medicines, if you are on aspirin, the blood thinners, or if you are on BP medicine, if you are on diabetic medications, if you are on any antiplatelet agents, anticoagulants, etc. It will be asked, because this is an invasive procedure. We will have to take care of all these things. If you are diabetic, the doctor will see your sugar control, and he will tell you whether you have to take the sugar medications accordingly depending upon your blood sugar. If you are having any kind of a body piercing, or if you are having any kind of pacemakers, etc., that you will have to notify it to the physician. Before doing this test, they will run a battery of tests for you. They will do blood tests, they will do CBC, they will do KFT, LFT, clotting factors, PT, APTT, everything, so that to be sure that no complications happen during this procedure. During this procedure, you should discuss this procedure with your doctor, and if you decide to have a sedative, the doctor will tell you that you should not eat for few hours before the test, or the doctor might instruct you before you come to the hospital regarding this. So remember that whatever is the procedure, the doctor would instruct you on this, and you will have to follow the instruction. You will also need to arrange someone to take you from the hospital to your home, because you will not be able to drive, etc., after this procedure. So you need some standby person with you, and based upon your medical condition, your doctor will give you specific preparation. There will be a consent form, and you need to sign that consent form. So you can read the consent form, and you can go through it and ask your queries and then sign the consent form. Whatever jewelries or any valuables you are wearing, you should keep it at home. You should not put those, or you should not bring them to the theater here, and you should empty your bladder before the actual process begins. The mild sedatives and local anesthesia is given before performing angiography, so that the person will relax. If not unconscious, he will at least relax. So but when we are doing it in children, we have to give them general anesthesia. Your heart rate, your blood pressure, your breathing rate, your oxygenation level, all will be monitored throughout the procedure. So once into the room, the patient will be asked to lie on a narrow table. Okay, and his patient is given some sterilized cloth. You will be connected to the ECG monitor that will record the electrical activity of your heart, and it will monitor the heart and also the procedure. So that will be continuously monitored. So what happens during a angiogram test? So during this angiogram procedure, the doctor will numb the area from where the catheter will go. So the catheter can go from the wrist, or the catheter can go from your groin. So that area will be numbed with the anesthesia. Or then what they will do is they will access your blood vessel here, and they will put a needle into the blood vessel. So they will slide a long and slender tube called catheter over the needle into a large artery. So they will, usually the groin is selected, and the catheter will move slowly and carefully. The thread the catheter through the your artery until the catheter tips reaches the part of the blood vessel which they want to examine. So where they want to examine the blood vessel, till that they will guide it. So carefully they will thread this catheter, and then they will inject a small amount of contrast material here, the dye, through this catheter and into your blood vessel segment. And for a few seconds you might feel little flushed at this point, and you also might feel like passing urine. And then the x-rays are taken. So then they will see how the contrast is moving into this in the x-ray monitor, and see how well the blood is moving in the blood vessels. So this area is numbed, I have told you where this catheter goes. So this is radial artery from the wrist, and this is the femoral artery from the groin. So this is the guiding catheter, this is the introducer sheath. So this introducer sheath in the groin or in the wrist we can place it. So here the area is numbed where the from where the catheter will go. A small cut is made inside your in the skin over your over one of your arteries, and usually near your groin or wrist, and local anesthesia is given so that we numb the area and it doesn't hurt, and they will access your blood vessel with a needle. They are placing this small tube made up of plastic called as a sheath, and here you can see how they have guided this catheter into the groin blood vessel. So this is how the catheter is moved through the blood vessel here. And what happens actually during the procedure is that now slowly this is moved till the tip reaches the blood vessels which we want to examine. Till that they will guide it. You can see clearly how this is moving, and it has reached here. Here you can see the way the dye is moving also. So they will inject a small amount of contrast dye to the catheter into your blood vessel segment, and I have told you this will make you a bit flushed during this injection. So they'll take multiple x-rays here, and they will see what is happening on the x-rays, how the blood is moving in these vessels. See, here you can see the contrast has come out here, and here you can see this, there is a blockage, almost around 80% blockage. The blood is not moving here, so they will find out this blockage. So your healthcare provider may find small blockages that don't need another procedure. So they might ask you to take some medicines or make some lifestyle changes. So you might have to eat healthy food, or you might have to exercise, lead a more active life, etc. Suppose if you are having larger blockages, then yes, they will go for invasive treatment. They might perform angioplasty and place a stent to open up your artery and keep it open. And sometimes some people need a separate procedure on some other day, and that is the bypass. When there are many blood vessels involved and the damage is blockage is very much, that time we will have to do something called as a bypass operation. We will have to create a separate way for the blood flow. So depending on the results, the doctor will decide what is good for you. Medicines are better, or bypass is better, or angioplasty is better for you. So this is what I have told you in the last class also. Angioplasty, when the doctor finds out that there is a blockage, he will go for a repair of such a vessel, and that is called as angioplasty. And an angioplasty may be all that you need if it makes your blood flow better. So here you can see that they have placed a catheter here, and then there is a balloon which is inflated here, and the narrowed lumen of the vessel is, they are trying to push it apart so that the balloon will expand, and it is trying to create a space wherein the blood can flow. So when they will move it, they're trying to make a road for the blood to flow here. The blood flow is narrowed here because of the plaques which are seeing, which are blocking. So they put a balloon, they inflate it, and they remove the balloon out, and then they have put a stent here, and now you can see how easily the blood flows. So that is how they put a stent, and that is how they repair this blood vessel. You can see that these are pushed aside and the blood flow is maintained. So the artery should be at least 70% blocked before a stent is placed, and in such arteries we can do this stent placing or the angioplasty. And if there are many arteries with many more blockages, and if the percentage of blockage is still higher, yes, we will have to go for this bypass surgery, which will create a different route only for the blood flow. So after this procedure, what we will have to do, after this procedure, you will be taken into the recovery room for observation, and you will be observed for a few hours. They will check your vitals, they will see how is your insertion site, is there any kind of a bleeding, etc. Suppose if you are feeling any kind of a chest pain, tightness, vomiting or bleeding, etc., you should immediately inform the nurse. The bed rest may be varying, it depends on 5 to 6 hours depending upon your specific condition. And sometimes you might feel the urge to urinate frequently because of the effect of the contrast dye which they would have given it to you. You will be given pain medication. You will be asked to drink enough and more water so that the contrast dye is flushed out from your body. Sometimes depending on condition, they might ask you to stay back and monitor, or they might discharge you on the same day after the recovery period. So after the procedure also at home, you should monitor the insertion site. If there is any bleeding, if there is any unusual pain, swelling, abnormal discoloration, etc. A small bruise is normal, but if you are seeing constantly large amount of blood at the insertion site, then you should notify it to your physician. And sometimes if your physician has used a closure device for your insertion site, you will be given a specific information regarding the type of closure device that was used and how to take care of that insertion site also. You have to keep that insertion site clean and dry. You will should not be doing any kind of a strenuous activity for few weeks. And if you are having any fever, chill, increased pain, redness, bleeding, or drainage from the insertion site, you should inform your doctor. If you are feeling that there is numbness, tingling, or any changes in the affected extremity, yes, you should inform the physician. If there is any chest pain, if there is pressure, nausea, vomiting, profuse sweating, dizziness, fainting, definitely it has to be taken as an emergency. What are the risk of angiogram? See, angiogram, the risk of angiograms are low. It is a minimally invasive procedure. There would be complication in less than 1% of the cases. It could be some amount of bleeding, or there could be infection, pain, there could be some kidney issues due to contrast, and an allergic reaction due to dye, or sometimes you might even have a heart attack. So these are few of the risks of the angiogram. So that was all about angiogram. How is it done, and what are the things which you have to take care before and after angiogram. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.